advices again regarding the session 5. So, who will take the case?
Okay, sir. I'm fine.
Okay. So, Dr. Islam, it is here Miss Diana.
Okay, 1 minute, sir. Okay, so tell me,
Take
sir.
your time. Take your time. Okay.
Okay, so now I'm ready, sir.
So, okay, Miss Diana, I will write it down in the screen.
Okay.
25 years old female, complain of easy fatigability.
Okay, sir.
25. You can see the board,
Okay, sir.
Miss Diana. You have 1 minute, Dr. Islam.
Okay, sir.
When you are ready, just tell me and we will start.
Okay, sir, right.
You can unmute yourself, Dr. Islam, when you are ready.
Okay, right, sir. Okay, sir, I'm ready, sir.
Okay, you can start, Dr. Islam.
Okay, hello, good morning.
Good morning, doctor.
I'm Dr. Islam, one of the doctors here in the clinic. Can I confirm that you are Miss Diana, 25 year of age?
Yes, doctor.
Nice to meet you.
Nice to meet you, doctor. Thank you.
Okay, thank you. I have been asked to talk about your health condition with you and examine you. Is that fine with you?
Yes, doctor.
Okay, thank you so much. I have gathered from your note that you have been complaining of some fatigability. Is that right?
Yes, doctor.
Okay, can you tell me more about that?
Well, doctor, over the past 6 months, I started to feel that I'm easily tired, doctor, and actually it's increasing over time.
Okay, right. And do you have any other complaint beside this?
Like what, doctor?
Like any dropping of your eyelid, any shortness of breath, any other things?
Yes, doctor. Sometimes I feel short of breath. Sometimes, doctor, yes.
Okay, so now you coming to your first complaint, the fatigability. You said that it is for last 6 months and it's become worse with time. Is it?
Yes, doctor. Yes, doctor.
Okay. And was it developed suddenly or gradually?
It started gradually, doctor.
Okay. Any specific time of the day or night do you have this complaint?
No.
Like in the evening or morning?
No, doctor.
Okay, right. Okay. Besides this, do you have any difficulty in your vision?
No, doctor.
Okay. Is there anything that make it worse, like with exertion or with other things?
Yes, doctor.
Okay. What are these things that make it worse?
Any effort, doctor.
Okay, any effort. Okay, right. And anything that make it better?
No, doctor.
Okay. And you say that you have also some shortness of breath with it.
Yes, doctor.
Okay. Is the shortness of breath present at rest or is it present on exertion?
On exertion, doctor.
Okay. How much distance can you manage without getting short of breath?
I don't know, doctor.
Okay. How many pillow you kept it for sleep at night?
As normal, doctor. As usual, one pillow.
Okay. Do you have any ankle swelling with it?
No, doctor.
Do you feel dizzy when you stand up from sitting position quickly?
Yes, doctor. Sometimes, yes.
Okay. Okay. And do you get failure these days more than usual?
What, doctor? Sorry?
You get failure like someone have told you that you are looking pale?
Yes, doctor.
Okay. Okay, okay. And do you have any bleeding anywhere from your nose or from your mouth or from your gums?
Well, doctor, no.
Okay. Do you have any cough with it?
No, doctor.
Do you have cough of any blood with it?
No, doctor.
Any blood in your stool? Any blood in your water work? And any blood in your bowel work?
Well, doctor, I think my periods, doctor, is heavy than usual.
Okay. And do you have any problem adjusting temperature?
No.
Okay. Any cold preference or any skin changes? Any change in your weight?
No. Dr. Islam,
Okay.
from your this echo beside you or?
No, that's I think coming from the group.
I will mute Dr. Islam, and you can unmute yourself. Okay. Okay.
Okay.
Please, Dr. Islam, unmute yourself and continue.
Okay, sir. So we were talking about your heavy bleed. For how long do you have this heavy bleed?
Well, doctor.
Hello.
I think it's a long way. Yes, doctor.
Okay. Okay. And are you taking any medication?
No.
Hello. Okay.
Yes.
Any lumps and bumps in your body?
No.
No. Any? What about your appetite?
It's good, doctor.
Okay. And do you have history of surgery in the past?
No.
Any family history of any significant illness, in specifically this joint?
I'm adopted, doctor.
Okay, right. Okay. Okay, I'm going to examine you at the same time. I will be asking some questions. Can you please show me your hand?
Yes.
I'm going to check for filer in the form, and then I'm going to look for spoon-shaped nape, leukonychia, and then I'll also looking for any other clue in the hand.
Negative.
Okay, I'm going to check your pulse. I'm going to check your pulse in BP and postural drop.
Normal.
Okay, I'm going to check for your conjunctiva for failure. Any jaundice with it?
Color positive.
Any jaundice? Okay.
No.
And any pigmentation in your mouth? Black pigmentation in your mouth?
Negative.
I'm going to look for your thyroid. Okay, any swelling in your neck?
No, negative. Thyroid, no need.
Okay, I'm going to look for your heart, to listen to your heart for any murmurs or any
You have 1 minute.
Any. Okay, I'm going to look for your chest. Okay, so Mrs. Denia, what is your concern?
So, doctor, what could cause my fatigue, doctor?
Okay, so I appreciate your concern, and your concern is quite genuine. Depend upon the history I have taken from you in the examination, I have this diagnosis. I have various diagnoses in my mind that you have this fatigability and heavy period. It may be because of some gland problems, or it may be some other local pathology. But we have to admit you, and we have to run some investigation that include the blood test and also some imaging tests, and then we will be in better position to tell you what exactly you have. Do you have any question you want to?
It could be cancer, doctor.
Sorry, sir?
It could be cancer.
Yes, it could be the possibility of this. It is a possibility, but we have to look for other reason. But it is less likely in this case, and we have to look for other causes, and then we will be in better position to tell you, right?
Okay,
We will involve a team of doctors that will.
Okay, doctor. Okay, doctor.
Okay, sir.
Okay, sir. Thank you, doctor. Okay, so what is your diagnosis and differential diagnosis?
Sir, my diagnosis is she is having this anemia, and also she is having menorrhagia.
Sorry, Dr. Isam, I can't hear you. Hello?
Also, underlying endocrine cause like hypothyroidism. The other cause could be, it may be fibroid uterus, and the other could be.
5 days.
There is an echo here. Please, Dr. Asim, please unmute. Please mute yourself, Dr. Asim. Continue, Dr. Islam.
Okay, sir. So it may be she is having anemia symptoms and menorrhagia. So it's maybe because of some gland problem like hypothyroidism. The other possibility could be some local pathology in the uterus like fibroid uterus, and other could be I'm not sure about other diagnoses, sir.
Okay. So what is the management plan here, Dr. Islam?
Okay, so I'm going to admit the patient and to run some bloodline tests. Like I'm going to look to check the full blood count to look for anemia and other infectious cause, and then I'm going to screen for any inflammatory marker like ESR and C-reactive proteins, and then I'm going to look for the ultrasound abdomen to look for any local pathology in the abdomen, in the uterus, and transvaginal ultrasound, and also I'm going to check for the thyroid function test.
Okay. Thank you, Dr. Islam.
Okay, thank you, sir.
Thank you, Dr. Islam. So here the case, Dr. Islam, you didn't do the scheme that I told you about before. Okay, you missed the social history totally, and this is a fatal mistake in station 5. Because the patient here, you must ask about the patient job and patient driving and smoking and alcohol and a financial problem and with whom who is living. Okay, this is very important. Social history, you missed it completely.
Okay.
And that, yes, you must write it down before you enter the room. You must write it down, as I will explain this after we discuss the case. Okay. So,
right.
A 25 years old female patient complain of fatigue, and you explored the history. Very good. And you, the patient mentioned for you that she has a menorrhagia, right?
Right, sir.
And you know that the patient has anemia as well, because the patient is pallor more than usual and is fatigued and having postural hypotension. So you know that the patient has anemia, and you asked about menorrhagia, but you didn't go in deep through it. So any case in station 5, any female case, you must ask about female history in detail, especially when the case is related to anything wrong with the menstrual cycles like amenorrhea or menorrhagia. So this patient has, right? So you must ask about, you asked about when did it first start, and I was not direct with my answer, and I did it on purpose. I told you that it's too long. It's from too long. You must ask me when was it is from the first cycle or not. Because if you asked me this question, I will tell you that this is from first cycle. And that signifies that this patient has something hereditary. Okay? When in station 5 they told you the patient is adopted, so you suspect a hereditary cause or a familiar cause. Okay? So the patient here has menorrhagia. You ask about, is it regular? What about, just tell me, what about your period? Is it regular? What about the amount? How many pads do you use? When was the last one? You must ask about these 3 questions, okay? And you must ask about, are you married? Okay, did you have any abortions before? Are you on oral contraceptive pills? And did you have any pregnancies before? This is a detailed female history. You must ask about 3 questions related to periods. Is it regular? Is it what about amount? Amount, you ask about amount, by how many pads you use daily. Okay, and when was the last one? So you will know that the patient has menorrhagia, and she told you that she has menorrhagia, and menorrhagia here is the cause of anemia. Okay, so you will run down your differential diagnosis. Okay, here this is a difficult case because when you enter before you enter the room is a case of fatigue, and when you enter inside it's a case of menorrhagia. So you must just explore it fastly when you think about it. You the first differential here is a hypothyroidism. Sorry, the first differential in your mind when you enter is hypothyroidism, not here. In your mind is hypothyroidism, and you did great by thinking about that. Hypothyroidism is a very important differential here, but it is negative. I don't remember you asked about whether preference or not, but I think you didn't ask about it.
I have.
You asked it?
I have asked, sir, any problem adjusting to temperature, any cold preference?
Yes,
I have
told
asked.
you negative. Yes, I told you it's negative. So you exclude it. So you exclude it.
Yes.
If you want to go further, you ask about any low mood, problem with your mood, any problem with your bowel habits. If no constipation, no low mood, so you make it not the first differential. If you ask it about when was it first started, I will tell you, as I told you, I will tell you it is from the first cycle. When I get the first period, it is with me, doctor. So it is something, as I told you, something hereditary. So the diagnosis here is von Willebrand disease. It's autosomal dominant condition. It can present as gum bleeding. It can present as epistaxis. It can present as skin rash, bleeding after surgery from dental procedures. It can present as hemoarthrosis, like knee swelling case. It can come. It came before, like hemophilia. It is a differential between von Willebrand and hemophilia. And here the case is female. So hemophilia is X-linked recessive disease. It's affect only males. It can affect females, but it's very, very mild. Okay? So the diagnosis here is von Willebrand disease. Okay? It's autosomal dominant.
Yes. Sir, I was considering some familial condition like this, blood disorder, but there was no bleeding from other orifices.
Yes, I have no bleeding. Yes, I have. It can present like menorrhagia only. It can present like lip bleeding only, like epistaxis only. Okay?
Okay, sir, right.
No rule.
Right,
no rule. No rule in exam.
Okay.
They will make it just like that. It came before just like that. So the first question, the most important question you ask, and you asked about it, but you didn't go further for it. It when first it started. You must stick with it. And you asked about family history, and sometimes in real exam, they told you that the patient is adopted. So you must suspect it's a hereditary cause. So the second differential here is hypothyroidism. First differential here is von Willebrand disease, and third differential here is ITB, or idiopathic thrombocytopenic purpura. And you asked about any skin changes, and I told you no, right?
Right, sir.
Yes. So you asked about general question, lump and pump, and you must ask about weight and appetite. I think you asked about appetite, but you didn't ask about weight. You asked about color. Yes. You asked about rise of body temperature. It's very important. You asked about diurnal variation of fatigue. This is a very important question. You asked about any water work or bowel or back passage changes. I told you no. And please, Dr. Islam, when you ask about bleeding from any body orifices, you ask just as a general question. You don't specify this. Ask the patient, do you have any bleeding from anywhere in your body? Because when you asked me, you specified it, and you asked me, do you have any bleeding from your nose? Or so I told you no. And after that, you asked me, do you have any bleeding from bowel habits or urine? I told you no, but I volunteered to tell you that I have heavy periods. So you ask just as a general question. Any case of fatigue, you ask as a general question. Do you have any bleeding from any body orifices, or do you have any bleeding from anywhere in your body? Okay. And regarding examination, Dr. Islam, please get focused in examination. Don't just examine anything because you will lose your time. So any case of suspected anemia, you must examine the abdomen. Here the case is of menorrhagia, and the patient has anemia. So any patient has anemia, regardless of the menorrhagia, you must examine the spleen, because all the cases of chronic anemia will have splenomegaly. So splenomegaly examination here is very, very important. Very important. Thyroid is important, and you mentioned it, and I told you no need. So you must examine the abdomen here for two reasons. For the splenomegaly related to anemia, and for menorrhagia, you must examine the abdomen for any masses, like you told me, any fibroid masses or something like this. Okay? So abdominal examination here is fatal. Very, very. Okay? Chest and the heart examination here is not important. Regarding clinical judgment here, you must admit the patient. Okay, but the patient has anemia and has posture hypotension, and you must do some work out for the patient, and you must refer here, as you told the patient, I will involve a multidisciplinary team for you, including a group of doctors to help you to reach the diagnosis, and we will run for you some blood tests and some investigation to help us reach our diagnosis. Okay. The investigation here, if the examiner asked you about von Willebrand disease, actually von Willebrand disease, it's like factor 8 decreased activity. And the difference between von Willebrand disease and hemophilia is factor 8 decreased level. But in von Willebrand disease, it's factor 8 decreased activity. Okay? And you will find activated partial thromboblastine time and bleeding time, you will find it elevated or raised.
Bleeding time will prolong.
Yes. Okay. And in case of mild attacks, you will give the patient tranexamic acid. Okay? Yes. And before operation, you will give the vasopressin. And if the patient has severe bleeding like this case, you will give the patient factor 8 or von Willebrand factor. But factor 8 is a priority because von Willebrand factor can develop antibodies to it. So the patient will not respond to it. So factor 8 and or von Willebrand factor replacement in severe bleeding. Okay, this is very important case, and it appeared in previous slides. Very, very important. A case of menorrhagia, you suspect 3 diagnoses. You suspect von Willebrand disease, you suspect hypothyroidism, and you suspect ITB.
Right, sir.
Okay. Well done, Dr. Islam. Please get stuck to my advice regarding station 5. Actually, station 5 in this manner, we have 2 station, we have 2 diets left other than the next diet. We have the first and second diet in 2020. It is the old. Yes. So we have.
Sir, in this case, I have one question, sir. Yes. Sir, I have asked that you have any family history of any bleeding. Now you say, sir, there is no bleeding history, but in von Willebrand, it is.
I told you I am adopted. I told you I am adopted.
Adopted so what does mean by doctor?
Adopted, Dr. Islam, means that I have. I'm not so good in English. Adopted means that when I was a child, I have no father and mother. You understand me?
Okay, sir. Okay.
Adopted means orphan.
Adopted. Okay. Adopted. I mean, you are saying that I'm a doctor, sir.
Yes.
Okay. It's adopted. I was considering that you are a doctor. Okay. I get the point, sir.
It's very common in the exam to tell you that I'm adopted. Actually, it's very common. Okay?
Okay, sir. Okay, so I get the point. Thank you so much.
I will share with you. Okay, please. Do you have a question?
Yes, it's clear, sir.
Okay. So, when you have, before you enter the room, just divide your paper. Okay? Here the complaint is fatigue. You make your differential diagnosis here. This is case 1. Okay? And here is the case. Sorry. 2. And here you ask about complaint analysis, your analysis of the complaint, and past medical history, and medication list, family history, social history, and female history. You can add here trauma and travel history if it's significant to your case. Okay? Are you following me, Dr. Islam?
Yes, I'm following, sir.
So when the scheme, when you have the paper in front of you and you ask the patient, you just look at these points. So you don't forget.
Sir, for this station 5, they give just one paper.
Sorry, Dr. Islam, I can't hear you. Again?
Sir, I was asking that for station 5, they just give one paper or two papers, sir. Hello, just, okay, sir.
One paper for all, one paper, only one paper.
Okay, sir, okay.
I don't remember one or two, but you just have to do this, because if you do it in the two papers, you will just get confused. So please do it like this, because you will have not much time. Okay, you will have two problems, two papers outside regarding complaint, and you will have one or two white papers. But if you did it like this, it's make it more easy for you. Here the second complaint and the differential before you enter the room. And this is for the two cases. Okay? It's very easy to miss family history or medication list, or to miss female history or social history as you did. So if you did it, it's unlikely to miss any of the following. Okay?
Okay, sir.
Okay. Okay. The examiners in station 5 will look for you, or if you are cool and calm doctor, you must be safe and you must be confident. Safe regarding your admission of the patient or follow-up of the patient or refer of the patient. Okay? So during clinical judgment, you must tell the patient, other than investigation and treatment, you must tell the patient you will refer him or not, and you will admit him or not. This is very important. And please, before examining the patient, be nice to him, be polite, don't cause any hurt to the patient, and excuse him before each step in examination. Okay? And if you feel that...
Okay, sir. Sir, I have one question, sorry.
Yes, please.
Sir, in this case, the patient need to be admitted, sir, right?
Yes.
And sir, the second question is that in a team of doctor whom to be involved, like in this case, it was wound valley brain disease, but we have a differential other like hypothyroid. So we will involve a gland doctor and blood doctor, or only just the blood doctor, like hematologist only, sir?
Yes, the female doctor and the blood doctor, and you may involve a gland doctor as well if you suspect anything. But the most important thing in clinical judgment here, you tell the patient we may have to admit him, because the patient may need a blood transfusion if the patient has severe anemia, because it's a long-standing problem.
Okay, sir.
Okay?
Okay, sir. It's very clear. Thank you so much, sir. Thank you.
Thank you, Dr. Islam. Thank you. The differential before you enter the room is very important. You write down your differential diagnosis. You get focused and straightforward when you get inside. There is a clock in every room in the PACES exam, but you may have no time to look at the clock. If you practiced a lot, you will know how much time do you have. And actually, if you practiced a lot, station 5 problem will not be the time in the inside. The time will be not the problem inside. Okay. The problem is that you get relaxed as much as you can and get fast and focused. So you must practice with the correct way a lot with a serious regular study partner. This is very important to get used to pressure inside, because there is a time pressure inside if you didn't get enough practice. So as I mentioned before, try to complete main topic or main systematic inquiry of the complaint and try to get your diagnosis in the first 3 minutes, please, to get yourself time for asking about the history. You must ask about social history, very, very important. You didn't ask here about the impact of this complaint about the patient job and daily activities, and you didn't ask about job actually, okay? Okay. So this is about session 5. This is a very important case. Okay. So we will get the second case about session 4. Who want to take the case?
Sir, can I do, sir? Can I do, sir?
Dr. Kausar?
Yes, sir.
Okay. Miss Sarah?
Okay.
70 years old patient. I will try to write it down here. Are you following, Dr. Kausar?
Yes, sir. Miss Sarah, 70 years old.
Yes, was admitted 1 week ago complaining of jaundice.
Okay.
And weight loss. Investigation done, confirmed cancer pancreas.
Okay.
Invading adjacent organs and causing obstruction of common bile duct. The oncologist decided that the patient is not for chemo.
Okay.
And ERCP is needed for stenting.
Okay.
Please discuss with Ms. Sarah the management plan and answer all her concerns. You have 1 minute to prepare yourself, Dr. Kausar.
Okay, sir. Follow.
Dr. Kausar, are you ready?
Yes, sir.
Okay, you can start.
Okay. Hello.
Hello, doctor.
I'm Dr. Kausar, one of the doctor here. May I confirm your name and age, please? Are you Miss Sarah?
Yes, doctor.
And you are 70 years old?
Yes, doctor.
How are you today, Miss Sarah?
Well, doctor, I'm not so fine, doctor. I feel tired, doctor, and my appetite is not as good, and my eyes got darker, yellow darker, day after day, doctor. I'm not so well, doctor, actually.
Sorry to hear that, Miss Sarah. I'll try to see why you are having like this, and we'll discuss more about this.
Thank you, doctor.
Miss Sarah, I'm here to discuss about your health condition. Is that okay with you?
Yes, doctor.
Miss Sarah, do you want anyone to be with you while we are having this discussion?
No, I'm good, doctor.
Okay. So may I know what is your understanding? What is going on with you so far?
Well, doctor, I feel that it's something serious, doctor, because I have weight loss and my eyes got darker and my appetite is not as good. And I did some research in the internet, and I'm afraid, doctor, it could be something serious, doctor.
Okay. May I know what serious you are thinking? What kind of seriousness?
I'm afraid, doctor, that I may have cancer, doctor, actually.
Okay. Sorry to hear that. And why you are thinking that you may have cancer?
As I told you, doctor, I did some research in the internet, and I think I may have it, doctor.
Okay. Ms. Sarah, I appreciate your concern. Yes, you are right that you are having some jaundice and weight loss, and that's why there were certain blood tests and certain imaging and many things done for you. So, did anyone told you that what exactly they are trying to look for?
No, doctor.
Okay, so your report came today, and I'm afraid that I have something bad news for you.
What do you mean by that, doctor?
Ms. Sarah, I'm sorry to tell you that we found in your report that you have cancer of pancreas.
I know it, doctor. I know it.
Okay. Okay. Are you okay, Miss Sarah?
Yes.
Hello, Miss Sarah, are you okay? Shall I give you some water?
Yes, please, doctor.
Okay. Miss Sarah, if you are okay, can we discuss more about this? I'm sorry for this bad news. I know it's very distressing and very shocking for you, but there are certain things which we can do. If you allow me, can I talk more about this?
Yes, doctor, please.
Okay, so let me draw this diagram. So this is actually our, food pipe, and from the down part of food pipe, there is our food bag is there, which is we'll call tummy, and there is one, leaf-like structure adjacent to this. This is the steel. So this is mainly responsible for certain kind of digestion of fat and many other things that is responsible for sugar control and fat digestion and all. So here is the main problem. And Okay, and when it is involving, definitely people develop jaundice because as I said, that it is mainly responsible for many other kind of digestion of our food. It produces important protein, but the other problem is that here there is the two way where it goes to the first part of our gut. So this so problem in your case, there is a growth and this part is cancer. So because of that, this is also obstructing the other part, which also secrete another protein for and it helps further digestion. Are you getting me?
Yes, doctor.
Okay, so this cancer is also blocking this pathway for further digestion also. So there are double problem is happening. First thing is this organ is involved, and because of cancer the other organ is also affected, and that also not able to do their work. Are you getting me?
Yes, doctor.
So actually, I'm sorry to say this cancer is a bit advanced now. So what we are going to do, will do certain kind of, you will be evaluated by a multidisciplinary team, and there will be cancer doctor, there will be dietitian will be there will be blood doctor, there will be gut doctor, and liver doctor will be there will be radiotherapy team will be there, and your GP and consultant and a specialist nurse, many people will be there, and you will be under their treatment and their care. Are you getting me?
Oh my God, doctor. It sounds serious, doctor. Is it?
Yeah, I'm sorry to tell you, it is a serious condition, and I'm afraid to tell you that usually sometime there are treatment, but this cancer is quite advanced, and I'm sorry to say that in this condition we will not able to do any surgery, or we cannot give you any kind of the special medicine to cure.
Oh my God. So there is no treatment for it, doctor?
No, there is no treatment. I'm very sorry to say, but we are there to take care of you, and there are certain things which we can.
How can I have cancer, doctor?
See, there are many things that for most of the time we don't have any reason, but sometimes there are some, people who has this soreness of this organ, which we say pancreas, and if recurrent pain and it is a long-term problem, people can develop. Sometimes there are certain excessive drinking and alcohol can change into, but most of the time there is no reason. Sometimes there are some bug infection can cause.
So, doctor, how much time do I have?
I appreciate your concern. I'm sorry to say I cannot give you precise answer because it will be evaluated by team, and there are something called palliative care, and that team will see and they will let you know. So let me tell you something more which I want to discuss with you, if you will allow me.
So, doctor, please don't tell my wife.
Hello.
Don't tell my husband.
Okay, may I know why you are saying like that?
She will get sad, doctor. Please don't tell her.
I appreciate your concern, and okay, and if you are thinking that we will definitely try to keep your confidentiality, but we'll discuss this matter after some time. Before that, I'm having something very important for you, which I would like to discuss if you will allow me.
So you will tell my husband, doctor?
See, I'm not going to tell, but it's good to inform them if you would like to, because you need the further follow up and further evaluation, and they can provide you care. So it's good to know them, so you will get the more care. And suddenly, if they will come to know, it will be very shocking. How do you think that? It's okay. It's not hurry. You can think, and if you think that you can bring him, or we can call them, and we can keep some nurse and our consultant, and we can discuss. It's no hurry to tell immediately. Okay. So I would like to tell you something that, since I said that I'm sorry that we cannot go for any incurable medicine or other treatment, but something is called, palliative care. The meaning is that we want to provide as much as comfortable and pain free. And we don't want you to have any nutrition deficiency and other thing. We want to keep you dehydration free and to dignify your life and to make your life very comfortable. And this special care we give with a group of doctor and Macmillan nurse, as I said. So our consultant, he decided to go for further kind of small kind of procedure. If you would like, I will explain you.
It will cure my cancer, doctor.
No, as I showed you, it will not cure. But as I showed you, there is some blockage. Because of that, you will develop more vomiting and throwing out, and you will feel the more sick. You will not be able to eat food. Not only
So
that.
What is this procedure?
This is called ERCP, endoscopic cholangiopancreatography. Shall I explain you if you will allow me?
Yes.
So in this the procedure, it will be done by a highly skilled person who did many times and who is doing every day. First thing what we will do, we will give you some kind of sedation and we will put a thin tube from your mouth after keeping you relaxed. And after in that end of the tube, I'm just drawing one picture. And end of the tube there will be camera, and we will put you we will put this camera through your mouth, and it will go to the first part of your gut. And after that, we will visualize this in the screen, which will be there in the operation theater room. In this procedure, are you getting me this point, or you want me to explain again? Is it clear till yet? Okay. Yes. After that, we will put another small tube from that, and we will keep some kind of the thin needle under your blood channel in your skin, and we'll put some dye. So the another tube which we are putting, it will break this obstruction. So you will not develop much, jaundice. Your symptom will be quite okay. You can eat, and there will be no throwing out. So it will provide, you will feel better, and your nutrition will be better.
Is it a procedure, doctor? Is it an operation? It
is not a very big operation. It's a minor kind of procedure, but as like anything, that this also has certain side effect. Although it's rare and not occur always. Sometimes it causes some bleeding and some adjacent organ tissue damage. Sometimes because of this dye, some kidney can affect. But although this is a rare condition, and in case if it will happen, we have our own way to deal that. How are you thinking?
This is too much, doctor. You told me that this is not curable, and now you want to operate me. Actually, this is too much, doctor.
I appreciate your concern, but when anything we need, first we outweigh whether benefit is more or risk is more. But in your condition, really, we have to give certain medicine for pain and for throwing out and for food. So this is really benefit is much, much higher. In front of that, risk is very low. And in case anything, we will follow you and we'll treat that complication if in case it happens.
No, I don't want to do it, doctor.
May I know why you don't want to do?
I'm already tired, doctor. You have 2 minutes remaining. I'm already tired, doctor, and this sounds to me a bit long. And actually, doctor, I'm not going to die, doctor.
No problem. I will give you some leaflet and brochure about this procedure, and also I will give you one consent form in which everything is written. You can take time, and we will make the meeting with our consultant, and we can discuss more about that. You can also think, and you can go through this leaflet. How important is also I would like to give some some leaflet and brochure for this cancer. So how it is affecting the life and what are the things they need to do. Is that okay with you?
Yes, doctor. Thank you.
Okay. Even if you will sign the consent form and if you want to withdraw before procedure, you have full right to do. So you can again think and will again have some appointment with consultant. Okay?
Okay.
May I know what, do you have any questions or any concern?
No, doctor.
Okay, and may I know that with whom are you living? You said your husband. Anybody else is there?
No.
Okay. And are you getting enough support?
Yes, I'm okay, doctor.
Okay. And I'm sorry to ask that. Do you have any financial issues or anything?
No, doctor.
Okay. And may I know that are you drinking alcohol?
No, doctor.
Okay. So can you just tell me what any question or any concern which I can solve and I can help you?
No, doctor.
So can I know that what is your concern? What did you understand so far?
That I have cancer, doctor, and I will going to die.
Oh, I'm sorry for this bad news. You know, as guys, I know it must be distressing. We all team are here, and I'll give you some contact number of our hospital, and also some nurse will come and talk to you more about that. Do you have anyone who can drop you your home, or you want us to call, or some kind of help I can do for you? Okay, okay. Okay, fine. Okay, I'll have another discussion. We'll come again. I'll try to come with my consultant and we'll have again, by that time you can go through more and you can think regarding your husband. It's not hurry, but you can think, and if you can call or we can call and we can also discuss. So you will get more support in future. How do you think that?
For the time, doctor, please don't tell him. Don't tell him, doctor.
Okay. Immediately we are not going to tell. It's your right. We cannot, breach the confidentiality. But definitely in long term, I think that it will be very good for you that you will have some family member and some support. So,
Fine,
okay.
Okay. So, what is the ethical issues here?
Ethical issues is autonomy. Patient has full capacity and she has right to know everything about her present condition, and she has right to accept or refuse any kind of treatment. Other thing is beneficent. So this patient, it's already the cancer is went to the common bowel duct and other place. So in this condition, chemotherapy will not be beneficial. And by doing this palliative endoscopic retrograde cholangiopancreatography will be beneficial for her. Non-malfeasance is there. If we'll do chemotherapy, it will be more painful and suffering will be more, and there will be no benefit to do that. It will be more painful for her, and offering the palliative treatment to make her life comfortable and to dignify her lifestyle. Also, if
Dr. Kausar, what is the legal issues here?
Legal issues are consent. Consent for this advance directive, lasting power of attorney.
Did you ask the patient about the advance directive?
No, because I thought that still it's not so, it's not good to give everything in one shot. We should have another meeting and we can discuss that time.
Okay. Thank you, Dr. Kausar.
Thank you.
Very well done, Dr. Kausar. Fantastic. Very, very well done. But I have a few comments in your performance. Overall, you will pass easily this station. You will get enough marks, about 15 or 14. I think lasting power of attorney here, Dr. Kausar, do not miss it. And advanced directive and living well is very, very important.
Mm-hmm. Okay.
You just ask about it. The examiner will not ask you why you did ask about it, because the patient here is for palliative treatment, as you mentioned. And you are right regarding this. The patient is cancer pancreas with metastasis for palliative treatment. So you must ask about living well and advanced directive and lasting power of attorney. This is very, very important. Very important. Okay?
Okay.
The case that you must ask about these points. This is the typical case. Okay?
Mm-hmm. Okay.
Consent and confidentiality. Please, when patient ask you about don't tell my wife, please tell him that, of course, after appreciation of the concern, tell him that, of course, we will not tell your husband about this. This is your right, this is your condition, this is confidential to you. But as you mentioned to the patient, he will help you regarding this. We can arrange a meeting and elaborate. But reassure him that this is his condition and it is confidential. It's very important. By agreeing that we will not do it. This is your confidentiality. This is your condition. Okay?
Okay.
Please, Dr. Kausar, use the patient name. This is very important, and it will make a difference in real exam. Use the patient name. Tell her, I'm sorry to hear that from you, Ms. Sarah. I highly appreciate concern, Ms. Sarah. And your voice tone was very good, but you didn't mention a lot of quotes and a lot of appreciations to concern and a lot of sorry for these bad news today. Your voice tone was very good, but you must use some sympathy and empathy more than that, and give more pauses, and speak slower than that, okay? And continue, okay? And when I told you that I don't want to do this operation, I just want to die, you told me no problem. The answer was no problem, and this is no problem.
Okay.
You told me no problem. You will die, no problem.
The meaning was actually for procedure. But, I understood.
You are concentrating about answer, but please, in real exam, this is a role play, and you must demonstrate even by your facial expressions to the target that you are caring about him. And you must tell her, you just take a pause and tell her that I'm very sorry to hear that from you. I can only imagine how do you feel now. This must be frustrating for you. I'm very sorry, Ms. Sarah, for what you are going through right now. Very sorry. Just like that, okay? Don't tell her no problem. Just if you agreed, we will sign a consent. No. This is actually against concern mark. The examiner will give you a mark down regarding the concern. This is very important. Please don't lose concern in just an easy case. Concern it by addressing and by appreciation before answering the concern. Just appreciate it. It's very important to appreciate the concern. Okay. It's very easy to get 0 of concern by just answering like this. Very easy. Okay?
Okay.
So overall, you were following a structured approach. The introduction was very, very good. You break the bad news early. You draw, and you must do a draw also for the ARCB procedure, and you must speak early for the ARCB earlier than that, and you must ask about lasting power of attorney at the end after asking about social history as you did, and begin to concentrate on your role and where the patient is, because the patient here is admitted. Okay, so don't offer him a driving home and he is admitted. This is very important. And please don't check understanding in such a breaking bad news condition. Okay, you can understanding in a medical error. If the surrogate is not angry with you, you can check understanding. But if the patient is broken and losing hope, you just even you don't need to summarize. But I think Dr. Kausar and all of you doctors, summarize is very important, very, very important in station 2 and station 4. Summarize is very important, and all the examiners feedback, they write down you are summarized or not. Summarize, from my opinion, is very important, and I see a lot of mark sheet feedback. Summarize is very important. If you summarize, they will write down you summarize to the patient. If you did not, they will write it down. Okay, and it is about clinical communication. Summarize is very important, but check understanding here, I think it's not appropriate here. Okay, because it is too much for the patient. The patient here is silent. He is depressed. I told you that I want to die, and you just tell me, please tell me what you get from our discussion today. I think it's inappropriate. Okay.
Okay.
Other than that, Dr. Kausar, you did great. Actually, you were very, very good. Okay.
Thank you, sir. Thank you.
Thank you, Dr. Kausar.
Thank you, sir.
So, do you have anyone of you doctors have any question?
Yes, Dr. Osama.
Yes, please.
Regarding the first case of station 5, could you please repeat for us the investigation and treatment?
Investigation other than the basic investigation, including complete blood count, you must mention to the examiner complete blood count is very, very important here, and thyroid function test, and you will do factor 8 level and activity. Okay, and CBC also complete blood count, looking for hemoglobin and looking for platelets to rule out ITB. Okay? And coagulation factor, PT and PTT, and bleeding time. They will be elevated in von Willebrand disease. And regarding treatment, I will share this with you now. Treatment of von Willebrand disease. Treatment of mild test. And severe text and before operation. Mild attack will give the patient tranexamic acid. For operation, you will give the patient ADH or vasopressin. Severe attack will give the patient either factor 8 or von Willebrand factor replacement. But von Willebrand side effect is resistance. It develops antibody to factor 8. Here the patient needs factor 8 and may need blood transfusion as well. Clear, doctor?
Clear, doctor. Thank you.
Thank you, Dr. Man. Okay, so we finished for today. Thank you for attending my session. It is my pleasure, and hope you will all pass from your first time or next slide, inshallah. If you have any queries, please share it with me on my group, and please enjoy the journey. Thank you, doctor.
Thank you, sir. Thank you very much to guide so much. Thank you.
Thank you. Assalamu
Thank you
alaikum.
so much, sir. Thank you.
Thank you.
Wa alaikum salam.